Nice to have everybody here for our Training Wheels Off support group meeting. As most of you know, we're having a guest. This is our monthly guest speaker. Is going to be Dr. Daniel P. Stein, neurology of cannabis physician. He's been in practice since 1993. He's the owner and principal physician of neurology of cannabis here in Sarasota. He has numerous certificates and licenses and professional appointments that would take me a while to read off, but he's kindly decided going to be giving us a presentation about how cannabis affects the body, but specifically how we as in the Parkinson's community could possibly find benefits if we so choose to with cannabinoids and cannabis. So thank you, Dr. Stein, for coming, and we look forward to your presentation.
Okay, fantastic. Hi, everyone. Yesterday I was talking with one of my patients about how things have changed since COVID and how we are doing so many things on Zoom. I kind of miss the in-person thing. I have to be honest, can I see a show of hands? Who misses in-person visits? It's different. It's different, but this is very convenient. Maybe one of these days we can all see each other face to face. Okay, so I'm going to share with you some information about how cannabis can help patients with Parkinson's. And this has been it's been basically an all-encompassing project of mine for the last 6 years. When COVID was going on, my neurology practice of 30 years was becoming very difficult. Nobody wanted to come to the office, but I was able to do cannabis medicine online, and the cannabis clinic just took off. We've treated over 5,000 patients. I've had hundreds of patients with Parkinson's disease treated with cannabis. And of course, I've studied a lot about how to provide cannabis therapy in a safe and effective way. And now I'm an international speaker. I'm actually educating physicians around the world on how to use cannabis for a variety of neurological and non-neurological conditions. But the talk I'm going to give today is going to be a general overview of cannabis medicine and Parkinson's disease. And I'm going to leave plenty of room for questions at the end. Okay, let's go ahead and share my screen. So, first of all, many of you have heard about CBD and THC. Those are the main cannabinoids or main parts of the plant that we know much about. There's hundreds of other parts of the plant, but the phytocannabinoids, the molecules that are on the plant, that's phyto, are mainly CBD and THC as far as what we talk about and what we use for medication. Endocannabinoids are in our bodies, put there by nature. That's the endo part. Like the endorphins are internal opiates. Endocannabinoids are molecules in our body that act like CBD and THC, but we produce them naturally. And that's why plant cannabinoids work, because they bind to receptors in our bodies that were put there by the grand designers to bind our own endocannabinoids. So if you think about how opiates affect the body, cannabis and the receptors in our body work similarly. We have our own endogenous cannabinoid system. And then, of course, there's synthetic cannabinoids. Dronabinol is a synthetic form of THC that was approved by the FDA in 1986 for nausea and vomiting associated with chemotherapy. And we still have dronabinol or marinol, as well as nabilone. These are synthetic THC molecules. And you can compare and contrast that to the THC that comes from the plant, the cannabis plant, which is part of an entourage of molecules. So we talk about pharmaceuticals and how it's one molecule at a time. And then we talk about plant medicine, which is many molecules. And even though I'm trained as a Western, classically trained neurologist, I am making this foray into plant medicine, which is a little bit different than what most of you are used to. Okay, so let's talk about the different parts of Parkinson's, the different symptoms, the different conditions, because when we talk about treating patients with Parkinson's, you have to ask, which symptoms are you treating? Are you treating the motor symptoms, rigidity, stiffness, slow movement, or bradykinesia and tremor? Are you treating dyskinesia, which are involuntary muscle contractions that occur sometimes right after dopamine therapy, or sometimes when the dopamine therapy, Cinemet, for example, is wearing off? There's non-motor symptoms, which include mental status changes, sometimes confusion and hallucinations or psychosis. There's sleep disorders. Uh, in particular, there's one type of sleep disorder, which is unique to Parkinson's, that occurs during REM sleep, where patients act out their dreams. Instead of being paralyzed during the dreaming process, the the patient with this type of REM sleep disorder is not paralyzed, and they punch and kick and sometimes hurt their bed partner. Um, so that's REM sleep disorder. But there's other non-motor symptoms. There's constipation, there's anxiety, depression. Um, there's a whole host of different symptoms. So we're going to talk about a few scientific studies that help guide us with our cannabis therapy, because what we do here in our clinic is not just, sprinkle cannabis, seeds, and give people joints to smoke. We use scientifically based evidence to come up with the proper amount of cannabis, the proper dose. And how do we know how to do that? Well, there have been studies. This one study was performed with smoking, actually, in patients that had Parkinson's disease, where they had fluctuations in their motor scores. And before smoking, and then after smoking, you can see that the score went down. So patients with fluctuations on off periods, some of you may have on and off periods, patients with fluctuations in this study smoked, and then following that medication, their UPDRS score, which is shown here on the y-axis, their UPDRS score, which measures the amount of motor disability, and a lower score is better, went down. And you can see here in patients without fluctuations, their score also improved after smoking cannabis. Now, you don't have to smoke cannabis to get the benefit. Um, but sometimes you do need to inhale the medicine, and there's ways to inhale it without smoking. And if you want to hear about that, we can talk about that more in the question and answer period. Let's talk about dyskinesia. Well, just so you know, that UPDRS score included rigidity, bradykinesia, and tremor. Now let's talk about dyskinesia. Dyskinesia are those involuntary twisting contractions that can affect the head and the trunk, sometimes the arms and legs, and they can be very debilitating. Usually dyskinesias occur after patients have been treated for 5 or 10 years with dopamine replacement therapy. And here we can see in this study that in patients that were given synthetic THC as nabilone, the dyskinesias went down within an hour or two after being treated with nabilone. And this is a 22% improvement in dyskinesia after patients consumed nabilone. And this is an oral therapy. This is a pill. And we can certainly do that with patients now. We can use cannabis orally instead of inhalation. And most patients don't want to inhale their medicine, and that's fine. You don't have to. But this was a very interesting study. And if you look on YouTube for videos of patients with dyskinesia being treated with cannabis, you'll see this on videos. Okay, let's talk about psychosis. Psychosis is a difficult situation because obviously patients with Parkinson's have enough problems, trouble moving, and now sometimes as a result of too much dopamine therapy, patients will develop paranoia, hallucinations, delusions, and those are all symptoms of psychosis. This is a very busy slide, but I just want to show you that in patients that were treated with CBD, okay, this is not THC. THC is the main psychoactive ingredient, but CBD can also be very helpful. And patients with 150 milligrams of CBD. So I'm showing you at the top of the second column here. Patients with 150 milligrams of CBD each day started showing some improvement in the total score here of these different symptoms. 250 milligrams of CBD were then given, then 325, and finally 400 milligrams. So what I'm showing here is that patients with psychosis-related symptoms treated with high-dose CBD up to 400 milligrams had significant improvement. All these numbers here in the last column show what are called p-values, and these are statistical analyses showing that there was a significant improvement. And it wasn't just in the psychological stuff. Patients also improved in their motor score. In sleep, I mentioned this peculiar REM sleep disorder that some patients have where they act out their dreams and sleep is disrupted. And it turns out that CBD in this pilot study, 75 milligrams of CBD was very effective in reducing these symptoms such as swearing, punching, laughing, kicking. Imagine this happening in the middle of the night, every night. And it doesn't have to be every night. These patients had an average of 2 episodes each week. And with 75 milligrams of CBD at bedtime, those episodes went to 0. So basically, 75 milligrams of CBD cured these Parkinson's patients of their REM sleep behavior disorder. This last patient required 300 milligrams, and the episodes went from approximately 3 or 4 down to once a week. So this is pretty cool stuff. When patients come to the clinic and are frustrated with lack of benefit from conventional pharmaceuticals, we can now say, okay, let's use cannabis and let's use CBD specifically for this particular problem. And this is the dose we need to use. So we have evidence to guide us. Now, how to use cannabis medicine is a bit of an art because vaping or vaporizing your cannabis is one way to inhale your medication. You could also use liquid drops under the tongue. You can chew and swallow gummies. Some of you, I'm sure, have heard of these cannabis gummies, which are soft chews. There's also capsules that you can swallow that look just like ibuprofen. There's creams that you can put on the skin that are very effective for things like knee pain or hand or elbow pain. The topicals do not work all that well for back pain, but we have other solutions for that. And then, of course, there's suppositories and smoking and some other methods of using cannabis. But the bottom line here is that each patient is different. And we need to, during our consultation, decide for a given patient what is the best way to take your cannabis. How long do you need it to last? What effect are you looking for, and what side effects do you want to avoid? So how do we figure all this out? Well, it's easy. You either come into the office or we do a telemedicine appointment. Most of our appointments are still telemedicine, but I'm sitting here in our new office location across from the Y on Potter Park Drive, and you can come visit me here. It usually takes about 30 minutes to do a cannabis consultation, and during that time, We talk specifically about your needs and preferences and side effects, and we come up with a plan for which cannabis products will likely help. And then, of course, we have to do a registration with the state of Florida because Florida is a medical state. It's not recreational for cannabis use. So you do need a registration and application to get completed. So I do that with you. Then we can talk about the specific types of medicine that you buy at the dispensary. So once the application is approved, which occurs the same day, with the treatment recommendation I will give you, you go to the dispensary, and there's about 15 of them in Sarasota. They're everywhere. And they're regulated, and they're good, reliable, professional stores. And you pick up the medicine and then start using it with the treatment protocol we discussed. I charge $250 once a year. That 250 is not covered on insurance, unfortunately, because cannabis is not legal on a federal basis. But that 250 includes all the advice you'll need for 12 months. There's also at least 2 or 3 visits that you'll have with me and my team during the year, and that'll set you back 250. That's been our price for the last 7 years. The state of Florida charges $75 once a year. That's the annual registration fee. And then, of course, you have to pay out of pocket for the medication. So depending on how much cannabis you'll need, the cost might be $50 or $75 a month, approximately. If you need high dose CBD, it gets more expensive. But in general, it's not terribly expensive. We want it to be affordable. And we do have payment plans and other hardship related payment arrangements, which we can make for those individuals that need us to. As far as next steps are concerned, we do have a team. I have 3 employees. They're awesome, and you can call Megan at this number, 400-1211, if you're interested in making an appointment or if you have any other questions. And then we also have Ryan and Cindy. There's Brody. He's gone now. He went to across the Rainbow Bridge in dog heaven. But this was our old office. I have to change this picture. So anyway, that's it for now. I'm sure some of you have questions, and I am here to answer those.
Okay, so what we can do is put it up for open questions. If you want, probably to make it the easiest way to we don't have a cacophony of people chiming in, is in Zoom, use the raise hand feature. Usually you'll find that under reactions. If you do the raise hand, then I just can call on everybody one at a time for those that have questions from Dr. Stein. I'll just start off real quick though. Dr. Stein, so how would folks in other states, because we have people from all over the country, plus we have a gentleman from Peru, how would they find out, what's available or if it's available medically in their state or not?
Well, medical in 38 states. And if you just Google Americans for Safe Access, they have a website that shows the state laws and situation at each state, Americans for Safe Access. There's lots of websites that will give you that information. In your country, Peru, for example, I gave a lecture to neurologists in Peru last year. I believe there is some medication available in a very limited way in Peru. Latin America is coming around. Brazil has some cannabis available as well. So the answer is, depending on what state you're in, you have to check your laws. But most states do have medical. What if there's a specific state? Maybe I can help you figure that out right now. But yeah,
Okay.
so it's different in every state.
Okay. Let's see. Our first question comes from, Joan. Go ahead.
If you live in another state but would like to consult with you, can you do that? Can you do the treatment via different states?
Yes. So I cannot practice medicine in another state because my medical license is only Florida. So we do what are called teaching sessions. And if if patients out of state or out of the country are interested in figuring out which cannabis products to use and how to use them, just call our office. We set up a teaching session, and it's not medical advice. It's just us talking, and again, it'll be a half-hour session for $250. I will review your medical records. I will talk specifically about needs um, and limitations, and then I'll give you a treatment protocol um, so that you can then know which cannabis products to obtain and how to use them. Now, it's up to that patient to find those products, but we can help. So, for example, I had a patient the other day in Ohio who I was able to give advice to, and then we kind of looked at their different dispensaries to try to help them find those meds in that state. So sometimes we can do that. Sometimes patients will source their cannabis from other uh, places, maybe under the table. So, we try to be cool about it. Um, but yeah, we do teaching sessions.
Great, thanks so much. You do Zoom calls, you can do
Thanks.
Zoom, right?
Yeah, we do it on Zoom.
Okay, great, thanks.
You're
You're
welcome.
welcome.
Thanks for asking the question, John. Okay, let's go over to Lisa.
Hello, I had a two-part question. If you can speak generally to the topic of CBD and THC balance and the use of vaping, how dangerous is that?
The CBD and THC balance in a given product and how we figure that out. Is that the question?
Yes.
So it's great. Thanks for asking that, Lisa. THC is the part of the plant that gets patients high, but it's also very important for things like dyskinesia, and pain and sleep and appetite, and anxiety. But if there's too much THC, that can actually cause anxiety, and it can definitely cause intoxication and impairment. So what we do is combine CBD and THC for many patients in a specific ratio. And let's say the ratio is 1-to-1. That means that in the gummy, for example, there's equal amounts of CBD and THC. CBD mitigates the intoxicating effects of THC. So if you're benefiting from THC, but you don't want the psychoactivity, then you throw in some CBD, and that reduces the likelihood that the THC is going to cause impairment. We have lots of patients that have to work, study. We have we have doctors, lawyers, and politicians in our clinic, and people need to work and drive and function. So if you need THC during the day, let's say for chronic pain even, if you add CBD, that enables the patient to use the THC. Plus, the CBD provides anti-inflammatory benefits and neuroprotective benefits. So we know that the different parts of the plant provide different advantages, and CBD and THC, for that matter, have been shown to protect neurons. And this is very important for Parkinson's as well as other degenerative conditions. When you use CBD and THC to protect neurons, you're going to hopefully reduce the progression of the illness. And we have lots of studies showing that. In fact, the United States government has a patent on CBD as a neuroprotective agent because the researchers at NIH discovered how well it worked as an antioxidant neuroprotective agent. So what do you think of that?
Interesting.
And the second part of your question, what was the second part of your question?
What's your view in general about vaping?
Vaping. Okay. So vaping is what happens with vaping is you heat up the cannabis oil extract and inhale it as a vapor. That's vaping. But in order for that cannabis oil extract to function in these vape pens, there's usually something added to the cannabis extract. Sometimes that additive can irritate the lungs. Sometimes it can cause pneumonia if the additive is produced in someone's garage.
Mm.
So 3 years ago during the summer, there was this outbreak of chemical pneumonia because people were buying bootleg vapes and they were tainted with vitamin E acetate, and it caused this terrible outbreak of pulmonary disease. So you have to be careful about your vape products. You want to make sure that the cannabis oil that's been extracted is clean, that it's free of solvents and other molecules that can injure you. But if you can do that and you get a regulated vape from one of the dispensaries in Florida, you're not going to injure your lungs. We know this because California went medical in 1996. And it's a big state with a lot of people vaping for the last 27 years. And there was a doctor out there as part of Kaiser Permanente that's been studying vape-related pulmonary illnesses and other problems like does cannabis cause cancers, lung cancer, if you smoke it or vape it? So they've been studying this for the last quarter century. And we know that as long as the vape is produced in a regulated way to prevent those toxins from getting in there, you're not going to injure your lungs unless you have COPD or chronic bronchitis. So those are the two conditions that you do not want to vape or smoke for that matter.
Very
That
helpful,
answers my
Dr.
question.
Stein. Thank you.
Very good. Okay, let's go to Eddie, all the way down in Peru.
Good morning, Doctor.
Good morning.
I actually went to the clinic in Lima, in Peru, because as you know, we've got neurologists. We're allowed to use cannabis. I was turned down for the use of cannabis for pain, and I just wondered how serious it is, because I've got angina as well as having the Parkinson's. I have angina. I have a bad heart, a bad valve on the heart as well. And the doctors refused me because they said it would finish me off, if you like. They said it would be very bad for me. Is this, you know, does this mean I can never get it to help relieve the pain?
No, it does not mean that you can never get it. But in patients with cardiac problems, we do have to be more careful with cannabis, because cannabis can cause a drop in your blood pressure. And if you're smoking high doses of cannabis, it can potentially cause problems with the coronary arteries because of the smoke. But in patients with cardiac problems, if you use liquid cannabis instead of inhalation, and you use the dose, the proper dose, you're not going to get into trouble with cardiac function. So I have many, many patients with cardiac disorders. I talk with cardiologists here in Sarasota about patients we have in common. And as long as we're careful not to overdose the cannabis, the cardiac side effects are not a problem. So I think what may have happened with you is someone who did not really want to give you cannabis, or someone that didn't know enough about it was nervous, was scared. They didn't want to make you worse.
Yes, it took
because
2 or 3 days to make the decision.
Yeah. And I understand that. Probably read there's articles that show that for certain cardiac patients, cannabis can be a problem. Tachycardia, which is rapid heart rate, can be a problem with THC. Some patients that use cannabis, they get a rapid heart rate. So if you have atrial fibrillation and you're using cannabis, that could make your heart rhythm worse. But if you use the correct dose and you're careful, you can still use cannabis. It's like any other medicine. There's the proper dose, and then there's the overdose, and then there's the underdose. You have to use the proper dose. And then you have to look at the other medications and consider drug-drug interactions. How is the cannabis going to mix with your other cardiac medications? For example, Coumadin, also called warfarin, and CBD can be a problem because if you're on an anticoagulant called Coumadin, the cannabis can affect the way the blood clotting timing is measured. And so you have to be aware of drug-drug interactions. You have to be aware of cardiac side effects. But in medicine, this is what we do. We look at it, our eyes are open, we consider the risk, we consider the benefit, and then we move forward. If you have a cardiac doctor there that's interested in talking with me about your specific case, I would be happy to talk with them. And so don't give up.
Okay. Thank you very much, Doctor. It's very helpful. It's, the knowledge that something may occur is good. Very good. Thank you very much.
All right, and I'll be including a link to Dr. Stein's website as well as the phone number at his facility if you're interested. I don't see any more hands. You could physically put your hand up. I'll look around for it. But one thing I was just going to mention real quick, a question I had for you real quick, Dr. Stein, was what do you think about the recent medication that was approved by the FDA for use that has cannabis in it? I don't remember what it was.
Epidiolex?
Yeah.
Yeah, so this is pretty cool stuff. About 10 years ago, I think close to 15 years ago, there was a young girl in Colorado named Charlotte Figge, and she had this type of epilepsy that was refractory to normal therapy. And her mom and CBD growers in Colorado produced a medication that reduced her seizures. So it was a life-changing event for her. It turns out that CBD for seizures was described by Elisaldo Carlini and Professor Mechoulam in Brazil in the late 1960s. We have other evidence that CBD can help with seizures. So there was a company in the United Kingdom, GW Pharmaceuticals, that did a study, a formal study. And this is what doctors need to see. If you ever talk to a doctor about cannabis, they'll say, oh, where's the research? Where's the evidence? How do I know what to do? So there were studies with CBD in patients with epilepsy that was refractory to pharmaceutical therapy. And we learned the proper dose and the safety profile on how to use CBD for kids mainly with these difficult to treat epilepsies. And sure enough, the FDA approved in 2018, it was Epidiolex, which is basically CBD. And so we are using now an FDA-approved cannabis product to treat epilepsy in the United States. Pretty cool.
That is pretty cool. Thanks for sharing that.
Yeah,
I got a
it's a
question.
good story.
Awesome. We have a question from Edie. Go ahead, Edie. I unmuted you.
Oh, you unmuted. Thank you. Hi, Dr. Stein. Good to see you.
You too.
I was curious. You spoke about using just CBD for psychosis and sleep disorders. At one point, I was told that the cannabinoid receptors needed to have a little bit of THC to kind of get them going. So if you don't have THC, does the CBD do its thing?
So there's many different kinds of sleep disorders.
Right.
The REM behavior disorder that I mentioned responds to CBD.
Okay.
Patients with psychosis related issues need to avoid THC because THC can make them worse.
Right.
But that's really just a small percentage of patients with sleep disorder. The vast majority of patients with trouble falling asleep or staying asleep do require THC. So you are correct. And that THC will bind to the CB1 receptor and it'll help reduce anxiety and promote relaxation and
Mhm.
help with sleep. So yes, you're absolutely right. The mechanism by which the CBD works is not directly through the CB1 receptor. That is true. So there's different kinds of sleep disorder. There's different parts of the plant that we use for different patients. And so, yeah, that's the art of medicine right there.
Right. Thank you. Can I ask you one more thing? I understand there are different varieties of cannabis, different types of plants. Can you basically talk about that a little bit?
Sure. Well, getting back to the sleep issue, there are some varieties of cannabis that are cultivated to promote relaxation and sedation. And traditionally, those plants were referred to as indica style, I-N-D as in dog, I-C-A. It's an old term, very old. In fact, it was coined by a physician named O'Shaughnessy, who in the late 1800s was in India, and he was treating patients in India with that cannabis preparation, and then he brought it to England, and he said it was cannabis from India, so that's cannabis indica. That's where that comes from.
Oh, okay.
And he gave it to the Queen, and the Queen used it for her migraines, apparently, and it
Oh,
worked like
Oh,
a charm. But
good.
anyway, in general, cannabis indica nowadays refers to plants that are cultivated to promote relaxation and sedation, whereas plants that are cultivated to promote a more energetic effect are referred to as sativa, S-A-T-I-V-A. Some of you old stoners may be familiar with those terms. And even though nowadays those terms are not as accurate from a medical standpoint as we would like them to be, those are the broad categories of whether or not a particular variety is going to promote relaxation or not. So within that spectrum of indica, sativa, and hybrid, there's thousands of other named cannabis varieties, 9-Pound Hammer, Silver Surfer, Girl Scout cookies, all these different silly names that the growers attach to a given variety or cultivar. We call them cultivars, cultivar of cannabis. These plants have specific components that are much like wine, because if you think about all the different kinds of grapes and wine that's out there, the different aromas and flavors, we have the same thing with cannabis. All these thousands of different varieties, whether or not it's a sleepy kind or an energetic kind, there's much more subtle aromatic qualities to the cannabis that also have biological effects. And that's due to what we call terpenes. The terpenes are the aromatic oils that give cannabis its unique characteristics. I could ramble on longer, but I think I'll just stop there.
that was
Thank
interesting.
you.
That answer your question, Edie?
Yes, thank you.
You're welcome.
Terpenes. Read about terpenes.
Okay.
And if anybody's interested in learning more about cannabis, there's a great website called projectcbd.org. projectcbd.org. There's a lot of reliable websites, but there's many more websites that are not reliable. So this is a good one to start with. The articles are scientifically based, but easy to read.
Oh, thanks so much, Dr. Stein. Okay, I'm gonna call on my wife next. She had a question. Go ahead, honey.
Yeah, so I know the state of Florida allows, the cannabis for medical reasons. And so if you were to start taking something, but then you had to travel, say out of Florida, how, like, do you have to wean yourself off? I mean, I don't know anything about cannabis. I've never taken it at all, so.
So yes, if you're legal in Florida and you have your Florida card, you're not supposed to take your cannabis across state lines. Even if you're traveling from one medically legal state to another medically legal state, the act of crossing the state border is a federal offense because cannabis is still not legal on a federal basis. That doesn't mean everybody does it though. I mean, people do it all the time and nobody seems to care, but you're not supposed to do it. And so if you want to play by the rules, then you won't be able to bring your cannabis outside of Florida. And you can stop your cannabis usually cold turkey. Usually, you do not have to wean yourself off the cannabis because it doesn't cause that type of withdrawal effect that other drugs might. Um, but let's say you use your cannabis to control tremor and insomnia. Once you stop the cannabis, those symptoms are going to come back. So you might be, we say that you might be dependent on your cannabis, but you're not addicted, which means you require it for symptom control, but you're not going to have a nasty withdrawal syndrome if you stop it.
Okay,
That's
thank
good to
you.
know. Yeah,
Thank you.
thank you for sharing that.
You're welcome.
Edie, do you have another question?
Yes,
Go
I
ahead.
do.
unmuted you.
Medications for relaxation and pain control can cause or contribute towards problems with constipation. Is that a problem with cannabis?
No, cannabis does not usually cause constipation. In fact, the cannabinoid receptors you mentioned earlier are very prevalent throughout the gut. And the endocannabinoid system modulates gut motility. And so for patients with irritable bowel syndrome, for patients with Crohn's or inflammatory bowel disease, we often use cannabis to help them regulate their bowels. And as opposed to opiates, which can reduce pain but cause constipation, we do not see that problem with cannabis.
Thank you. Thank you.
Daryl, did I see your hand up, Daryl?
You may have already kind of gone through this, but how about what's the interaction with if we're already taking a medication for symptoms, whether it be amantadine or carbidopa, levodopa, or taking medicine for depression? How do you go about making, you're looking for making adjustments in the current doses, and how does that work? Your total package?
Good question.
Yes, so the question has to do with what we call drug-drug interactions.
Yeah.
And the answer is, it depends on what you're taking and what your dose is, and what kind of cannabis you are going to take and what your dose is. So there's no boilerplate answer for that. It depends on what the two drugs are. So for example, I mentioned how Coumadin, warfarin, and CBD could be a problem. We did touch on that briefly. For amantadine and Sinemet and other dopamine replacement therapies, there's no significant interaction with cannabis therapy.
So we would likely continue.
Yes, you would continue. But if let's say you're taking something for anxiety, and you want to try cannabis instead, what we would do is, or pain for that matter, and you want to consider a cannabis therapy, what we usually do is we do both, we do both medicines together for a brief period of time and start with a low dose, because if you're using cannabis and you're using something to sedate you because of anxiety, let's say you're taking Xanax or alprazolam, or or you're trying to sleep and you're taking a sleeping med. What we do usually is add small amounts of cannabis therapy and then increase the cannabis slowly, and you would continue your other medications at the same time. And then once we notice that the cannabis is helping you, then we taper off the other medicines, because usually with those other pharmaceuticals, you do have to taper. So yes, that's a great question. And again, it depends on which drugs and what dose they're on, what dose you're on, and how long you've been taking it. There's this medicine called clonazepam or Klonopin, which is a sedative that a lot of patients take for anxiety and muscle pain and sleep. And it can take 3, 4, or 5 months to come off the clonazepam while we increase the cannabis. And we just do it. We handle it. We make it happen. But it depends on which drug you're taking and what the dose is.
Thanks.
You're welcome. Anybody else? I'm looking for hands in the window.
Linda.
Oh, Linda, go ahead. Let me unmute
Yes.
you. Go ahead. There you go, Linda.
Hi there. Did anybody discuss cost?
Yes, briefly, in Florida, you need a doctor's authorization to use cannabis therapy.
Right.
So our clinic provides authorizations and advice and required visits for $250 each year, once a year, $250.
And the cost of the cannabis?
Depending on how much you'll need, it costs approximately $50 or $60 a month. Could be more, could be less. That's also out of pocket, and you have to bring cash to the dispensary for that. And then the state charges $75 each year. So there's 3 costs. The state is $75 once a year. Our clinic is $250 once a year, and we take $50 off for veterans, by the way. And then you have to buy your meds at the dispensary.
Okay, thank you very much.
You're welcome.
Just so you know, Linda, too, the dispensaries, many of them have sales. So if you you like a particular kind of edible, let's say, sometimes they have, buy 2, get 1 free, or they have a certain amount off. So you just wait for the sales and you'll save a significant amount of money.
That's useful.
Yep. All right. Anybody else? I'm looking for hands in the video monitors. If anybody has another question.
Does anybody, I have a question for the group. Does any does anybody here have that type of REM sleep disorder where you act out your dreams? Does anybody have that, Roger? Oh, 1, 2, 3. Wow. Well, you guys have to call me, because it's like a slam dunk, It's the CBD rather than THC is very unlikely to cause any side effects. And it'll probably take, a month of increasing the dose to potentially improve the quality of your life. So, I mean, you guys should call, and I'll just say this. Cannabis is not great for everybody, and it's not great for everything. I've had a lot of patients with Parkinson's tremor that do not respond to cannabis. And I think it's because they're not willing to use a high enough dose of THC. We really need to activate those CB1 receptors to get that tremor under control. And that's a challenge. But there are other symptoms of Parkinson's disease that we are successful with most of the time, especially anxiety and depression and sleep and pain. When it comes to postural instability, shuffling and balance issues, cannabis is not great for that. I just want you guys to realize that, it's good for some things, it's not great for everything, but I'm here to address your specific needs if you want to give us a call.
Thanks, Dr. Stein. Yeah, we have the saying that if you met one person with Parkinson's, you met one person with Parkinson's. Everybody's on a different journey. But I will say this, recently a study said that if for patients that before they're diagnosed with Parkinson's, if they have loss of sense of smell, REM sleep disorder, and constipation, 90% likelihood that they have Parkinson's.
Yeah, that's right. That's right. I agree.
All right, still have Dr. Stein for a few more minutes. If anybody has a question they want to ask. Oh, whose hand was that? I saw somebody's hand go up.
Judd,
Judd. Go ahead, Judd.
I was just, while we were talking, looking up articles about, I have REM sleep disorder. I have literally pushed my wife out of bed, kicked her out of bed. I have waken up as my knee hit the floor as I jumped over the bed. I almost hit my head on the bedside table. I grabbed a light and tried to hit my wife with it at a hotel room. And now we don't sleep in the same room because it's very safe for either of us. But I was just looking at, since it's been such a big problem, I've sort of solved it a little bit by taking the clonazepam, whatever it's called. But anyway, I was looking up articles about it, and I found one in the National PubMed National Archive, whatever it's called. And it's called cannabidiol for rapid eye movement sleep behavior disorder, and the conclusion is that it doesn't help. And then I looked for other articles, similar articles, and I saw that there was another one that said it did help, that they tested 4 people for this research paper, which doesn't mean a lot to me. So I'm just wondering about your conclusion that it helps.
No. My conclusion is that I believe that it probably will help. But the studies that show that it doesn't help, you have to look at those critically and determine what dose did they try. So oftentimes when it comes to CBD, the studies do not use enough CBD. Most patients that are trying CBD on their own do not use enough. It turns out that CBD is not very potent. It's the opposite of THC when it comes to that. And if you buy CBD gummies online or in the corner store, you're going to consume 10 or 20 milligrams, maybe 30 milligrams. But for the sleep disorder we talked about before, you need hundreds, 75 at least, but sometimes more milligrams of CBD. Where was that CBD obtained, and how were those patients diagnosed? So I think it's fair to say that if you look hard enough online, you will always find an article that shows results that contraindicate or show different results than what you're looking for, always. And that's fine. So you have to then do a deeper dive and look more carefully at that study, how it was done, what dose they used, and so forth. So I'm confident that it's worth a try because it's so safe. The studies, you're right, sometimes they show that it benefits, sometimes they show that it doesn't. So I appreciate you sharing that.
Thanks, Judd. Don Koski, did you have your hand up? Okay, never mind. Let me go back to my wife's question. Go ahead, Sue.
Oh, just a quick question. You mentioned edibles. Is there some that are better than others to take, or is it vary on what you're using it for? Like, is it better to use a gummy other than a different kind of form of cannabis?
Chocolate versus gummies versus something else?
I mean, I don't know what's available.
So is your question about one edible versus another edible?
Yeah, yes, one better than another, or like more potent, or just the way the form of it's being delivered.
Yeah, it does not make a whole lot of difference as long as you know what you're consuming. So if you're going to swallow 10 milligrams of THC as a chewable gummy, or if you're going to swallow it in a capsule, it's not going to make a whole lot of difference. But cannabis does get absorbed in the gut more rapidly and more efficiently if there's other fatty stuff in the gut. So if you have a meal that contains some fatty foods, take your cannabis after that, and it'll work better. If you're consuming a brownie with cannabis in it and it's got some butter in there, that may get absorbed better than, let's say, just cannabis extract. So yes, the vehicle, we call it the vehicle that you use to consume your cannabis can make a difference in the rate of absorption, but not a whole lot in the effect.
Okay, thank you.
That made me think when you said brownie, it brought back a memory from the 70s and hash brownies. Oh, okay. I got Edie, you have another question?
I do.
I don't want to keep
Um,
you too long, by Dr. Stein.
Yep. And then we have Robert as well.
Okay, just
Okay.
a question about driving. It's illegal to drive under the influence of cannabis. With alcohol, there's a legal blood alcohol level that's been established. Have they established any way of determining whether a person is under the influence?
So thank you for that question. Driving under the influence is a no-no. If you're taking opiates or alcohol or cannabis or sleeping meds, if you're DUI, you're DUI.
Right.
But when it comes to cannabis, the blood levels don't matter a whole lot because some patients have a high tolerance for cannabis and they can pee positive or they can have a positive blood test or urine test and not be impaired. If you go skiing in Aspen and come back after eating some gummies while you're out there, you're still going to have a positive urine test a week or 2 or 3 later. That doesn't mean you're impaired. So when it comes to cannabis and assessing impairment, most states are using the roadside sobriety test with coordination, eye movements, and tandem walking to determine DUI status for someone who stinks of cannabis when they open the door. There are some saliva tests that are being developed to show recent cannabis use, which is interesting, as opposed to remote cannabis use, since the blood tests do not give information about recency or not. So the jury is still out. Can I say it that way? There's saliva tests, there's urine, there's blood, but when it comes to cannabis, the blood level and urine level, for example, does not always correlate with the degree of impairment. So the roadside sobriety test is still the gold standard.
Thank you.
You're welcome. Robert, did you have a question?
Yes, Roger, I do. So with rigidity and bradykinesia, it slowed me down a lot. Now using cannabis, which also slows down your reaction time, how is it not making that situation worse? And my second question is, has there been any studies and what does it do to the gait? When I walk, I freeze and I stick. How is the smoking the cannabis going to help that?
So unfortunately, you're 100% correct. When it comes to rigidity and bradykinesia, cannabis may not help. And the THC in cannabis could make that worse. Same thing with unsteady gait. When it comes to freezing and shuffling and retropulsion, falling backwards, the THC in cannabis can make that worse. So I don't have a good formula for helping you with that. But I can tell you the story of one patient I had who was so anxious about balance and walking that using cannabis to help anxiety was able to help their walking. So it wasn't so much the bradykinesia and gait instability, it was the anxiety about that that was making the freezing episodes worse. So what this particular patient used was smoking cannabis when they started feeling like they were going to wear off and start freezing. They would smoke a little bit and then they would relax and they were able to move better. So, so you're absolutely right. Cannabis can worsen slow movements. So we have to be careful.
Yes, thank you.
You're welcome. Drew, do you have a question?
Well, more of a statement to address Linda's concern about costs. One of the things that my wife and I do is make our own edibles. And you can do that, make chocolate edibles or gummy edibles and cookies, and actually know what the dosage is with some minor arithmetical exercises.
There's a website.
Yeah, and there's a website that'll help you know what your dosage is. So it's not a crap. And it's also fun, a fun activity. It's like making Christmas decorations, but you're making cookies or cannabis edibles.
Be careful not to lick the bowl.
Yeah, don't lick the bowl freely.
Don't lick the bowl.
It'd be dangerous.
Don't lick the bowl and make sure the grandkids can't reach them.
Right.
Yeah, good point.
Or
Thanks,
dogs.
Yeah, that's
Yeah.
right. Good point.
But yeah, thanks for that, Drew. Making cannabis, and for that matter, growing your own cannabis, I believe is a very therapeutic process. You know, if you can grow your own medicine and produce your own medicine and adjust your own dose, that's a beautiful thing.
Linda, do you have another question?
I do. A quick question. I've been taking some CBD sleeping pills from Floyd's of Leadville. Do you know anything about that? Can you speak to its effectiveness? It seems like it's okay, but it's expensive.
Yeah. So two things. When it comes to CBD for sleep, you have to be careful because low doses of CBD, 10, 15, and 20 milligrams, can actually have an alerting effect in 20% of people that take it and can make your sleep issues worse.
Okay.
So I'm not a big fan of low dose CBD for sleep. We use THC mainly for sleep, but if you want to use CBD, you usually have to get over that 25 milligram range, and then CBD has a more of a sedative quality to it. Secondly, there was a study done of online CBD products. This was published in the Journal of the American Medical Association. And it turns out that 70% of online CBD products were not accurately labeled. Some of those had 0 CBD in it. Some had THC and everything in between. So whenever you're purchasing products from an unregulated vendor, you have to remember that you don't really know what you're getting.
Yeah.
Right. Thank you.
Yeah,
The
if you want to
products
buy
from
CBD, sorry,
Go ahead.
Roger. If you want to try CBD, you know, vendors, there's 2 that I recommend, and I'm not getting any kickback, I swear. One is the growers out in Colorado that treated Charlotte. That's the Stanley Brothers, and they call that Charlotte's Web. So you can go online to read about the Stanley Brothers out in Colorado, and their product is Charlotte's Web. That's very reliable CBD. And then there's a physician up in Maine. His name is Dr. Sulak, Sulak. And he sells CBD, and I learned a lot from him. He's one of the pioneers in medical cannabis, and he has a reliable product. And his website is called healer.com. There's others. There's other reliable vendors. Those are just 2.
Yeah, it seems like the products that come from the dispensary, they all have certificate analysis with them, so that they seem to have a much better quality product.
That's true. So the certificate of analysis, thanks, Roger, is is the chemical analysis of every product that they sell at the regulated dispensary. And that allows us to, be comfortable that we're using a medication that's not going to hurt you, that doesn't have any contaminants or mold or pesticides or heavy metals. So I think that's one good reason to pay that $75 to the state each year, so that they can continue to regulate these products.
Yeah, I agree with you wholeheartedly. All right, anybody else before we say goodbye to Dr. Stein? Oh, but Robert, go ahead again. Let me just unmute you real quick. Go ahead, Robert.
One more question on the gait dilemma. My problem when I walk is I'm leaning forward. I'm pitched forward. That's what's causing the shuffling and the imbalance problem. I can't seem to stand straight up. My physical therapist tells me that it's not a physical problem. It's a mental problem, basically all in my head. Is this true? And how can cannabis help that?
So that posture where you're flexed as part of your Parkinson's is part of the neurological problem. There's not necessarily a problem with your spine,
Right.
So, for example, you could probably sit straight up, or you can lie flat on your back. So your spine, might be perfectly straight, but your posture is flexed. That is part of the neurological disorder. So that's true. And cannabis is not great for that. I'm sorry.
It's okay.
Yeah. What cannabis can do, though, is cannabis can reduce muscle tone. So part of the rigidity that contributes to that flexed posture can be relieved with cannabis. So, cannabis is a very potent muscle relaxer. So we can use the cannabis to reduce the rigidity and potentially reduce some of that flexion of your posture. But we have to be careful, because it can make your balance worse.
Right.
Patients that use too much THC have trouble with balance.
Right.
So it would be one of those situations where we would have to be careful with your dosing and take it one step at a time, literally one step at a time.
Thank you, doctor.
You're welcome.
Well, thank you very much, Dr. Stein, for coming today. I think that this was the highest attended meeting we've ever had. So I think everybody was very interested in the topic. I'll definitely include links to your website as well as a phone number to your office. So if those that want to reach out to you that live here in Florida or another state for consultation can do so. And again, thank you so much. This meeting was recorded, so it will be available eventually on YouTube for those that want to watch it again or want to send a link to somebody else to watch it, or those that missed the meeting.
Hey, just before we sign off, I just want to give everyone just a reminder that Roger is amazing. He approached me a year ago to schedule this talk. I'm amazed that I remembered. But his efforts to coordinate this and put this together are really above and beyond. So kudos to you.
Thanks very much, Dr. Stein. I love this group. They make my day, and they keep me motivated and they keep me going. So thank you so much.